Within this section, we're going to be discussing an update on the efficacy or the effectiveness of fecal microbiota transplantation in the treatment of multiple recurrences or multiple episodes of C. difficile infection. In a previous section, we discussed the initial landmark studies that paved the way for multiple other studies to be conducted. And in clinical practice, many practitioners in the infectious disease and the gastroenterology field believe that fecal transplant is a bit of a superhero in it being a very effective treatment for patients with multiple recurrences of C. difficile. So where does this superhero MO come from? It comes from a number of different studies. What we're looking at here is a single study by Qureshi et al. That was published back in 2017 that pooled multiple other studies looking at FMT in patients with multiple episodes of C. difficile. They looked at 37 total studies. Of those 37 studies, 7 were done prospectively, meaning the studies were initiated and then data was collected into the future, whereas 30 of the studies looked back into the charts of individuals who had been previously treated. So 37 total studies were included, and overall, fecal transplant was incredibly effective, with an overall ability to eradicate C. difficile of 92%. Therefore, approximately 9 out of 10 individuals who had multiple episodes of C. difficile previously were effectively treated with a fecal transplant. Within this study, they also showed that a lower administration, either via enema, via flexible sigmoidoscopy, or via colonoscopy, had a more positive or a better result than those individuals who had an upper administration, either via a nasoenteric tube, a tube inserted into the nose, down the esophagus, past the stomach, and into the small bowel, and having the stool transferred that way, or via capsules, where individuals with C. difficile swallow a number of capsules over a couple of days. In addition, when they compared a vancomycin taper versus fecal microbiota transplantation, fecal microbiota transplantation was more effective here again. Once again, it's important to remember the individuals within these studies had multiple recurrences of C. difficile, and a vancomycin taper is absolutely an effective way to treat a single recurrence or perhaps a second recurrence. What we're focusing on with fecal transplant are 2 or more recurrences. And finally, they compared those individuals that had a transplant with frozen stool that was subsequently thawed versus fresh stool, and there was no statistically significant difference. So stool that is created or frozen in a stool bank, such as OpenBiome or other stool banks, and then sent in a frozen format and thawed, seems to have a similar effect to freshly donated stool. For you as a patient, it's important to understand that fecal microbiota transplantation seems to be a very safe and effective therapy for multiply recurrent C. difficile. It also seems to be most effective being administered via enema, flexible sigmoidoscopy, or colonoscopy, but we eagerly await clinical trials looking at pharmaceutically produced products that have phase 2 or phase 3 data through the Food and Drug Administration. Once there is an FDA-approved product to treat multiply recurrent C. difficile that is a form of fecal transplant, I think all of this data is going to be a moot point because we will have a much more rigid and structured data set to go by and further understand the efficacy of fecal transplant for individuals. For you as a patient, fecal transplant is a wonderful option if you've had multiple recurrences. And I would advise you to seek a provider who performs fecal transplants in any format if you've had multiply recurrent C. difficile.